To start this presentation, we're going to play a little game called How and How Fast. The answers will be slow, which would be days, weeks, months, or so the way that we're going to play this The first thing that we need to do when looking at the respiratory system is to look at the anatomy of the thoracic cage. My son's training to be a mechanic, and he always wants to know what's under the hood before he looks at a job. So let's look inside the thoracic cavity and see what makes it up. So at the very top, you're going to have two clavicles, one on each side. And then in the very middle of the chest, you have the sternum, which is sometimes called the breastbone because it lies between the two breasts, both male and female. And there are three parts to this. There's the manubrium at the top, and if you look, it kind of looks like the knot of a tie. And if we come down, the actual part, the tie part, is called the body, and then the very tip is a xiphoid process. At the top of the manubrium of the sternum, if you put your finger at the base of your throat, you should be able to feel a little U-shaped depression, and that's the top of the manubrium, and that's your substernal notch. You have 12 pairs of ribs, and ribs 1 through 10 can usually be easily palpated. Of course, in reality, if you have a patient that has a little bit more meat on their bones, it may be harder to palpate. However, ribs 11 and 12 generally can't be palpated very easily on anyone, and these are the floating ribs. They connect to the body only at the point of the spine, so they're less stable than the first 10 sets. You also have 12 vertebrae, T1 through T12, and then you have your right and left scapula. The diaphragm is the floor of the thoracic cavity, and it's a large dome-shaped muscle. The job of the diaphragm is to separate the thoracic cavity from the abdominal cavity, but it also plays an important role in inspiration and expiration, which we will talk about in just a bit. Thoracic landmarks are very important with assessments, but also with interventions. Certain types of interventions, such as a needle decompression for a tension pneumothorax, require you to be able to find these landmarks. Same thing when you're assessing lung sounds. So the first one that I want you to look at is the sternal angle, or the angle of Louis, and that's the area of articulation from the manubrium and the body of the sternum. So right where the manubrium, if you remember the analogy, the knot of the tie meets the body of the tie, or the body of the sternum. And that is usually a continuum of the second rib. And that marks the site of bifurcation of the trachea. Costal angle. This begins at the xiphoid process, and it's the meeting point of the left and right costal margins. And usually it's going to be 90 degrees or less. And this is important to know because you may note that in your COPD patients, their costal margins are going to be increased because of the chronic overinflation of their lungs and the rib cage. Now we're going to take a deeper look. That's the middle part between the two lungs, and it contains the esophagus that leads down to the stomach, and then it has the trachea, which bifurcates into the right and left main bronchi into the lungs, and it bifurcates at the sternal angle. You also have now I'm a very visual. I also liked this illustration because it kind of shows you from right underneath the skin level down into the thoracic cavity. So it's just another view. Reference lines. What are they and why are they important? Well, as we talked about in the previous slide, knowing the anatomy of the chest helps you to be able to assess it, and it also helps with some interventions. So the use of reference lines helps to pinpoint physical findings and to communicate that with other healthcare workers. So if you're doing an assessment, this will help you to chart exactly where you're hearing maybe an adventitious lung sound. So looking at this picture, we have the mid-sternal line, and this is a vertical line that goes straight down the sternum. Then you have your mid-clavicular lines. Now remember, we have two clavicles, so you're going to have a right and a left mid-clavicular line. And it's basically the center of the clavicle straight down the chest. You also have your vertebral line, which you'll see better in the next slide, as well as your anterior axillary lines. These illustrations rest on the diaphragm at about the 6th rib level. Now you'll note that the lobes of the lungs are not symmetrical. This is an excellent illustration. And again, this is just another view down into the pleural cavity, a nice transverse view so that you can take a look.
To give you an inside look into the pleura and the pleural space. What is the pleura exactly?
The pleura is a continuous membrane of cells that folds over onto itself at the apex and at the base of each lung.
What is the pleural space?
Well, the pleural space is a potential space that's between the parietal pleura that lines the inside of the chest wall and the visceral pleura that lines the lungs as the two pleural membranes fold upon themselves.
What are the functions of the pleura and the pleural space?
The pleural space helps regulate the pressure inside and outside the lungs during breathing. It is thought that the fluid in the space provides lubrication for the pleural surfaces on the lungs and the chest wall as they slide against each other during the breathing cycle.
How much fluid is in the pleural space?
This visceral space is estimated to hold between 8 and 10 milliliters of fluid per side in an average-sized adult man. So it's not very much fluid. And under normal circumstances, that amount is held at a pretty fairly constant volume.
The four major functions of the respiratory system is to supply the body with the O2 that it needs for energy production, also to remove carbon dioxide as a waste product, and it also helps to maintain homeostasis with acid-base balance in the body and the bloodstream. And when there's alterations in this, that's when you're going to see your acid-base imbalances, such as alkalosis and acidosis. And it also helps maintain heat exchange. Now, this is a little less important in humans, but if you think of dogs that can't sweat, how do they cool themselves off? They pant. So it does play some of a role in human heat exchange as well. I don't know if you've ever noticed, but if you're in a very hot and humid climate, you may find yourself a little bit more short of breath than you would be in a cooler climate. And that's your body just trying to blow off some excess heat.